Good morning and welcome to Facebook Live with the County of Santa Clara. My name is Corina Herrera Loera. As you can see, we'll be taking off our masks just during the segment so you can understand what we're saying, and we can have our translators see our mouth as we're speaking. Today, public hospitals have been continued to respond with COVID-19 pandemic. We will be discussing how county-owned public hospitals and clinics continue to prepare and respond to the COVID-19 pandemic and what they have learned. Jill Sproul today is a Chief Nursing Officer at the Santa Clara County Valley Medical Center, and she will be joining us this morning to discuss hospital operations. Thank you, Jill, for being here today. I know it's busy times at the VMC.
Yes,
I can imagine.
Yes, it is.
So we're going to go ahead and begin with our first question to you. What are you doing now in response to the pandemic there at VMC?
Well, actually, we've been doing a lot over the past 6 months, and we continue to work aggressively to combat this virus and this pandemic. We are working really closely with the county's EOC to make sure we have the proper supplies, equipment, in addition to our surge planning, to make sure we have enough critical care beds, medical surgical beds, and staff to provide high quality care to our patients. We have also continued to learn more about the virus, and in addition to our county, the entire country and world, we're learning how to provide better care for these patients. We have also made some structural changes at our public hospitals, and now we're providing video and televisits, which is something that we had to implement rather quickly, so patients can safely see their providers and not necessarily have to come to the hospital if not needed. We are back online with all of our operating rooms, our elective cases, our procedures. So we are making sure that people that need care, whether it's because they are COVID positive or for all other non-COVID procedures and operations. Our operating rooms continue to be open all week long for emergencies and for elective cases. And I think one important thing that we're really doing is every single day we are assessing the situation, monitoring all the dashboards, and looking at the trends up or down, and also our hospital capacity, our ventilators, our critical care beds, and we continue to watch this very closely.
Thank you, Jill. And I think you answered a couple of things because I'm sure a lot has shifted from 6 months ago. But are there any other things that have shifted in the hospitals from 6 months ago, how things were being done to how they're being done now?
Yes, we have. One of the first things we've done at all three hospitals is we've put up triage tents. So when patients come in, it used to be they would come in our ED, emergency department waiting room, but now we can quickly assess patients for any what we call ILI symptoms, influenza-like symptoms, and keep people segregated so we can provide, so there's not any mixing of patients. And so we have 4 tents at VMC. St. Louis also has a tent, and so does O'Connor. So this has helped us be able to quickly triage patients. We also mandate all visitor and employee screening of temperatures and universal masking. So we encourage people, patients and visitors, to wear a surgical mask, and if they come without one, we provide them. So everyone in the hospital is wearing a mask. And we have also changed our visitor policy, so we really need to limit the amount of visitors, and I know this has been very hard on families, so we are really decreasing the amount of visitors, but under special circumstances, end of life, pediatric patients, labor and delivery, there are special circumstances we are allowing visitors, but again, this has been hard on our families, and we know that, so we are trying to encourage iPads, FaceTime, and if a patient or family doesn't, a patient doesn't have a way to communicate, we provide the iPad because, combating isolation is really important for our families. We've also instituted a family communication. So when people are in the hospital, we facilitate communicating what's going on with the patients, both from our providers and the nursing staff.
Thank you so much for that. It's very important to be able to connect our families, right, during that such hard time.
Yes.
What have you learned and or your staff learned in treating patients with COVID-19? Anything special that you've done since, the beginning to how you're doing things now?
Yes, we have learned a lot. Early on, we were very quick to put patients on ventilators, but we're using other modalities, high flow oxygen, and so that's really helped. And we're seeing a less of a need for our critical care beds now because we are using the use of steroids and other medications. And so early on, when we had our big surge, we had a lot more critically ill patients than we're seeing right now. So that is helping us with our ICU capacity and our ability to take other medical emergencies that are non-COVID. We are also, again, using video chats and use of technology, and we are doing a really good job of social distancing and keeping our staff and patients safe when they come to the hospital.
Thank you. We appreciate you. We appreciate all the staff that are working hard in our hospitals at this time and throughout these hard times. And you are not just doing the work, but you're also learning as you're going and implementing new things. So we really appreciate that. And in general, does a hospital accept transference from other locations, other counties? Can you explain a little bit about that?
Yes, because fortunately we do have capacity at all of our hospitals, so we continue to accept our trauma program remains open for pediatric and adult. Our burn center remains open, and so we do get out-of-county transfers for those two programs. But we also, if any other part of the state is overwhelmed and does not have enough ICU beds, we do have capacity, and we would help out our surrounding counties or other parts of the state. If other hospitals were to be overwhelmed by critically ill patients, we also work with the EOC to be able to facilitate transfers. We are here for the community, and we are in this together, and it's been so inspiring to see the healthcare workers coming in day after day. And as we have we're 6 months into this, or like 8, I guess, six, I don't even know what month it is, but because we've learned so much, I see the staff's confidence and level of really knowing how to care for these patients. And when I round in the hospital, the nurses and the providers taking care of the COVID patients are very confident, and they tell me, Jill, we got this, we have this, and we are here for the community. And so it's very inspiring to see how we've come together as a county, and we've come together as 3 hospitals, and we've also come together for the community to care for these patients.
Thank you. Definitely these hard times have really highlighted the heroes of our current times, right? Our nurses, our doctors, our firemen and our firewomen out there working hard during these hard times. Thank you so much. And now, can you tell us a little bit why following the public health guidance is so important also in your department?
Yes, it's up to all of us to really make sure we decrease the spread of the virus, and we do everything to mitigate it, which is social distancing, wearing face coverings when we're out in public, good hand hygiene, wiping down high-touch surfaces, and not participating in any large gatherings. And really, it's up to all of us to decrease the spread. And by decreasing the spread, we are decreasing our hospitalizations, our patients that potentially could fall ill, critically ill, or even pass away. So we want to encourage everyone to follow the health orders and follow all of the guidance to decrease the spread.
Thank you, Jill, again for your time. And as she mentioned, it's important for all of us to continue to follow those orders. As you can see, we have at least a 6 feet distance from us today, ensuring we continue to wear our masks. And remember, you can continue to tune in every Monday, Wednesday, and Friday here at 10 o'clock. We'll continue to have people like Jill and others from our community to talk about resources and what we're doing in our community to respond to COVID-19 and other issues that come up as they come up. And so remember to continue to stay safe, keep your families healthy, your health. We need everybody during this time. Thank you, Jill, again for being on, and we'll see you on Friday at 10 o'clock. Thank you.
Thank you for having me.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.